Hi, my name is Leah. I'm from Loudoun Sports Therapy Center. I'm a physical therapist here, and today I'm going to be talking to you about common reasons for hip pain that we see in physical therapy and ways we can treat them. The hip is a large weight-bearing joint, and it's responsible for allowing us to do a lot of our daily functions, including walking, even running, stairs, up and down from chairs. So it's responsible for a lot of activity. So the reason it's so important to come in for your hip pain is to make sure that you're able to do all those things. So the number one reason we see for hip pain and the most common long-term cause is going to be arthritis or degenerative changes in the hip. Basically the space in your hip joint, because of putting weight through it for a lot of years, there's less cushioning in the joint, there's just less space there. So what physical therapy can do, while we can't get you a new hip joint, is help strengthen all around the hip and your abdominal muscles so that it takes the pressure off of the joints. So another major cause for hip pain that we see in physical therapy is trochanteric bursitis, which is also sometimes called IT band syndrome or IT band pain. And this is pain that you get on the side of your hip. It can result from an injury, from overuse, or just from like poor posture or weakness. And basically what's happening is you're getting friction from this thick IT band that runs along the side of your leg, and that's causing pain in the bursa. It's causing it to inflame. The bursa is the fluid-filled sac that the IT band kind of runs across. And so the way we treat that is we look at what parts of your body specifically are tight or weak, and we help to correct those imbalances. And then number three, a major reason we see hip pain is sciatica or sciatic nerve pain. This is when you get discomfort in the back of your hip, usually right in the middle of your gluteal muscles there. And this can be caused from having too much tightness in those muscles. Sometimes it even can be a back issue that the pain is kind of referring down there. And basically those tight muscles are compressing on your sciatic nerve, which is a huge nerve bundle that runs from your low back, down the back of your hip, and all the way down the back of your leg. And it can cause numbness or tingling or just pain right in that posterior hip region. So we treat this with stretches, something called nerve flossing, which kind of glides the nerve along the muscles, and then also strengthening all around the hip joint. So if you are experiencing hip pain for one of these reasons or for any other reason that you're concerned with, call the number below and we'll get you in to get evaluated by one of our physical therapists and get that hip feeling better.